I mean, it's really important because if you don't have a good quality tear film, you're not going to get good scans. You're also going to get fluctuating refractions or scripts. So when we refract you on our phoropter, which is the little machine over here,
Right.
that's the phoropter. So when you come to our clinic, you'll sit down in the chair and your refraction will be taken by the optometrist. So we find that with an unhealthy tear film, you get unstable prescriptions, fluctuating scans. So it's critical. So all our patients are on preservative-free lubricants, omega-3 supplementation. We really prime the eyes for surgery before we do the surgery.
Okay. And are there any other systemic or medical factors that matter? Like, for example, if somebody's pregnant or breastfeeding or have diabetes or something else, do those factors also come into
Yeah, so we
consideration?
have like a whole questionnaire that patients are asked when they come in, but we ask things like, do they have any autoimmune conditions? Because that can sometimes mean that you have a higher propensity for dry eye and ectasia. We ask patients if they've had any previous herpes infections in the eye or infections in general, if they've had any corneal scarring from foreign bodies or anything that might prevent us getting a clear suction for the laser or clear plane for the laser. We also want to know about their occupation. So we've touched on this before, but we want to know, as I said before, are they a mixed martial arts expert? Well, they should not be getting LASIK then. They should be having SMILE perhaps because we've got less risk of flap complications. Even surfers and things, I usually say it's probably better to have SMILE in case the surfboard, hits the eye or there's an accident. So I think occupation is really important. Overall health. Is the eye healthy? Do they have diabetes in the eye? Do they have glaucoma? If there are other problems, then generally they're not a great candidate for laser. But again, it depends on the severity of these conditions. So I think it's really important for patients to come in and have an assessment. We take a thorough history and go through all those questions. And then the same thing is done again for the clinical exam. We go through all the different parameters that I spoke about before and more in the initial assessment, and then again with the doctor consult. Specifically for pregnancy, so pregnancy itself is a complete contraindication for any kind of laser eye surgery. Breastfeeding is a little bit different. There's been various papers on it, but essentially, usually if you're 90 days postpartum, so 90 days post-pregnancy, and the script's stable, then generally it's okay. But it does vary, and again, it's a case-by-case basis. But it's a very clear cut for if you're pregnant.